All right, today we're jumping right into the middle of a medical investigation. We've got a patient with a really confusing and, frankly, dangerous set of symptoms. The clock is ticking, so we're going to follow the clues, we'll analyze the evidence, and see if we can crack this diagnosis together. Let's get started. So this is the big puzzle at the heart of our case. You see this classic trio of symptoms: fever, headache, neck stiffness, and your mind starts racing. It could be something fairly minor, or it could be a full-blown, life-threatening emergency. Getting this right and fast is absolutely crucial. So where do we even begin? Okay, first up, a patient's urgent problem. Our investigation, like any good medical mystery, starts with the person at the center of it all. Someone has come to us looking for answers, and we need to hear their story first. So, who are we dealing with? Our patient is a 22-year-old guy. Now, his age is actually a really important piece of this puzzle, so just keep that tucked in the back of your mind as we start gathering more clues. Okay, so he tells us he's been feeling sick for about 3 days now, and it's not just a cold. It started with a fever and what he describes as a brutal headache. But now it's gotten worse. He's got a stiff neck, light is physically painful to look at, and he says he's having a hard time just thinking straight. This combination of symptoms is a massive red flag. It's pointing straight towards inflammation around the brain and spinal cord. All right, section 2, gathering the initial clues. We've heard his story, now it's time for the physical exam. This is where we stop just listening and start looking for actual physical signs that can either confirm what we're thinking or send us in a totally new direction. And boom, right away, the exam shows 2 really critical signs. These aren't just random findings, they are textbook indicators that point us toward a very specific problem. These have some fancy names, Brudzinski's and Kernig signs, but what they mean is pretty straightforward. You see, when those protective membranes around the brain and spinal cord, the meninges, get irritated, something interesting happens. If you gently flex the patient's neck forward, their hips and knees will automatically bend up. It's a reflex they can't control, and it's a direct sign that those membranes are inflamed. So, all the evidence is pointing in one direction: meningitis, which is just inflammation of the meninges. But here's the thing, that's not the end of the mystery. It's just the beginning. The real critical question is, what is causing it? Is it a virus? Is it bacteria? Or is it something else entirely? To get that answer, we've got to go a level deeper. That means doing a lumbar puncture. You probably know it as a spinal tap. We need to get a sample of the cerebral spinal fluid, or CSF. That's the fluid that bathes the brain and spinal cord. And let me tell you, it holds the key to this whole case. Okay, section 3, the key test results. The lab results are in. This is the moment of truth, where we let the fluid itself tell us what's going on inside our patient's body. Let's see what it says. Literally everything comes down to this little sample of CSF. What's inside it? The cells, the proteins, the sugar level, all of it is going to paint a very precise picture for us of exactly what's happening inside the central nervous system. Okay, finding number 1. The white blood cell count is way up, which screams infection. No surprise there. But the real clue is the type of white blood cell we're seeing. It's mostly lymphocytes. You can think of lymphocytes as the immune system's special forces, the ones that are experts at fighting off viruses. That is a huge clue. Finding number 2. The protein levels in the fluid are elevated too. This just adds to the picture of inflammation. Think of it like this. When those protective layers get inflamed, they get a little leaky, and protein from the blood seeps into the spinal fluid. So this fits perfectly with what we're seeing. And now for our third, and honestly, maybe the most important clue of all. The glucose level in the CSF is normal. Now, you might think, normal? So what? But in this mystery, a normal finding is an absolutely massive clue. Why? Well, because some of the bad guys that cause meningitis love to eat sugar, and others don't. All right, section 4, solving the diagnostic puzzle. We've got all the pieces now: the patient story, the physical signs, and these 3 key lab results. It's time to lay them all out on the table and see what picture they make. Okay, check out this table. It lays everything out perfectly. Let's look at our patient's results on the left. Mostly lymphocytes, high protein, and normal glucose. Now, let's play detective. Does this match a bacterial infection? Nope. A bacterial fight brings in neutrophils, the immune system's frontline soldiers, and it causes low glucose. How about a fungal or TB infection? Again, no match. Those guys also chow down on glucose, making the levels drop. Our patient's results line up perfectly with only one column: viral infection. Let's just be super clear about this. The #1 reason we know this isn't bacterial meningitis? The glucose. Bacteria are hungry little critters. They gobble up the glucose in the spinal fluid so the level plummets. Our patient's glucose was normal. Bacterial infection is officially off the table. And you know what? It's the exact same story for fungal or TB meningitis. These organisms also need energy, so they consume the glucose, which leads to low levels in the CSF. Our patient's normal glucose level just doesn't fit the pattern, so we can confidently cross these off our list too. And that brings us to Section 5, the final diagnosis revealed. We've crossed off all the other suspects, we've systematically eliminated every other possibility, we're left with only one conclusion that fits all the facts. The diagnosis: viral meningitis. Every single clue, from the first symptoms you described to that last critical lab value, all point to this one answer. Case closed. So let's just run through the evidence one last time, right? The immune response with those lymphocytes totally points to a virus. The normal glucose level, that ruled out the bacteria and fungi. And remember that very first clue we got, his age? Well, it turns out viral meningitis is the most common type for his age group. It all fits together perfectly. So we've solved it. But that leads to the biggest question, the one that really, really matters. This isn't just a fun puzzle. Why is telling these two apart, viral and bacterial, so incredibly important? Because the difference is night and day. One is often managed with rest and fluids, while the other is a deadly medical emergency that can kill in a matter of hours without the right antibiotics. Getting it right and getting it fast can literally be the difference between life and death.